Hi, today I'm going to talk about investigative procedure in pathology. So first of all, let's look at the PowerPoint. So what is pathology? Pathology is one category of the medical science, and which is diagnosis disease through the examination of organs, tissues, body fluids and whole bodies. It has 9 disciplines, and which include anatomy, histology, biochemistry, clinical forensic, general, genetic, hematology, immune pathology, and microbiology. Each discipline has different typical tests and research different field. This presentation is focused on the hematology and the 3 typical tests of the hematology. In hematology, there are several typical tests, and the full blood count, hemostasis testing, anticoagulant testing, and antenatal testing, and blood tapping, and bone marrow biopsy and collection. In this presentation, we just talk about first one, full blood counting, the second one, hemostasis testing, and the last one, blood tapping. So the first one is full blood count. So what is full blood count? It is ABO blood typing system, and which is examining the blood group of the person, and it depends on whether there are some antigens on red blood cells of the person or not. And the ABO blood typing system decomposes the blood into 4 categories, and which are type A, type B, type AB, and type O. And using blood samples mixed with antibodies against type A and type B blood, and check whether the blood cells stick together or not. And there are no cells in liquid part of the blood is mixed with blood type A and type B, which is known explicitly. If the person who with type A blood have anti-B antibodies, and those who with type B blood have anti-A antibodies, and both types A and type B are contained by type O blood. In addition, if the person who has substance of Rh factor has to consider Rh positive, inverse consider Rh negative. Blood tapping normally take blood from the vein, and which is inside of the elbow or the back of the hand. The puncture site has to be cleaned firstly by using germ killing product, and then tightened the upper arm to increase pressure by using elastic band, and then insert into the vein, removing the elastic band during the test to cover the circulation, and finally stick the band-aid goods with blood collected. It is important to know the blood tapping, because blood transfusion can save health, even the life for many patients, for many people. And however, the doctor has to identify whether intermixability between the blood tap of donor and the blood tap of the patient before they perform the blood transfusion. And the next one is full blood count. And full blood count is a common blood test which seek blood abnormalities through measure amount of blood parameters to diagnose a variety of disease and infection. And it measures different features of blood, which including counts the total number of red cells, white cells, and platelets in the sample, and determines the ratio of red cells to plasma, and determines the count of each of the white cell subsets, and works out of the average hemoglobin level in the red cells, and measures the average size of the red cells. And full blood count test is examined under the microscope in order to be more accurate. And the procedure for the full blood test is similar with the blood typing test, and normally take blood from the vein, and the injection site may have slight bruising for 1 or 2 days after the test. And the sample of the blood abnormalities possibly involves abnormal red blood cells and hemoglobin, abnormal red blood cell to plasma ratio, and abnormal white blood cells, and abnormal platelets. And FBC is important for patients not only diagnosing the condition of the blood, and it can indicate the disease presence of the organs as well. And the next one is abnormal red blood cells and hemoglobin, which is anemia, might indicate there is insufficient iron in the diet, or cause some chronic disease. And in the contrast, a high level of red blood cells and hemoglobin can cause chronic lung disease or physiological changes depending on the living places of high altitude. And the next one is abnormal red blood cells to plasma ratio, which the plasma of red blood cells lower than the normal ratio might indicate anemia, or it might be dehydrated or has too many red cells. And abnormal white blood cells involves it will high level of the white blood cells will indicate disease like viral infection or bone marrow, and the high level white blood cells will might be bacterial infection or inflammatory disease. And the last one is abnormal platelets. And the low level of platelets may cause by autoimmune disorder and viral infection, or taking some drugs. And the high level of platelets are produced by reasons of bone marrow of inflammatory disease. The last one is hemostasis typing. Hemostasis typing is the normal physiological response of the bodies to prevent or stop bleeding, and it can maintain the blood flow as circulation working. And however, the failure of hemostasis will lead to bleeding or hemolysis, and both outcomes are severe for patients. In hemostasis, there are several tests, but today we just talk about PT and APTT. And the first one is PT. PT PT measures the integrity of the extrinsic system, and APTT measures the integrity of the intrinsic system. And PT is the blood test of measure how long the time takes for blood to clot in liquid protein, and it helps to diagnose the clotting disorders of the patients with taking medications. And the sample of the blood are taken by puncture and collecting into a closed container, and it measures the collecting times of plasma in the presence of plastin. And the normal range is 11 to 16 seconds. And the results of PT is abnormal in patients, maybe because of the patients drink alcohol, taking excessive antibiotics or other drugs. And the next one is APTT. APTT investigates bleeding disorder, and it often used to monitor the unexplained bleeding or clotting, and as well as used to monitor heparin therapy. And the APTT orders along with the PT and PT test, and by using blood clots help stopping bleeding. And the extended APTT is clotting takes a longer time than expected, and it may procedure the deficiency of coagulation factor or other specific reasons. And furthermore, knowing the person bleeding history of the patient is most important in hemostasis, and inform what kind of anti-thrombotic or anti-platelet agents drugs used before, or any inherited bleeding diathesis of family history, and then making the screening test according to the situation of the patients. In the conclusion, today we talk about the hematology and several and the three typical tests of the hematology, which is blood typing and full blood count, and IPTT, and introduce each of the typical tests. And as a result, the hematology can diagnose and treatment the blood disorder through the test. And this test go through under the microscope in order to become more secured. And however, all of the tests have the limitations. And before doing the test, the health provider have to investigate the history of the patients entirely, and to avoid the misdiagnosis. Okay, this is my presentation. Thank you for your listening.